A very good evening. From stories around the world to stories here at home, this is the National News Broadcast. I'm Vidushni Sadish Kumar.
I'm Movin Hettiarachi and here are today's headlines. The third stage of construction of the Central Expressway begins. The number of fully cured COVID-19 patients in the country has increased to 27,552. The number of COVID-19 infected patients in India exceeds 10 million. The government to focus more attention on job creation in the task of developing the country. 3 people have been reported missing when a cab fell into Vaunikulam Reservoir in Mullaitivu. India bowled out for the lowest score in its Test cricket history. Now on to those and more stories in detail. In today's top story, the third stage of the construction of the Central Expressway from Pothuhara to Galagedara has commenced today. Prime Minister Mahinda Rajapaksa has presided over the inauguration ceremony at Lihinigiriya on Vadakada, Pothuhara Road in Kurunegala. The distance of the section from Pothuhara to Galagedara via Rambukkana is 31.7 kilometers. The expressway is comprised of 4 lanes. The Road Development Authority, in its charge of construction under the district supervision and instructions of the Ministry of Highways, the project is expected to be completed within 42 months at a cost of 142.5 billion rupees. The first and second stages of construction of the Central Expressway are already underway. The first stage of the expressway stretches over a distance of 37 kilometers from Kadavata to Mirigama. The construction of 41 kilometers of roadway from Mirigama to Kurunegala is being carried out under the second stage. The procurement process for the commencement of construction in the fourth stage is presently being conducted. It has been pointed out that during the regime under the presidency of Mahinda Rajapaksa, the construction of the Northern Highway had also commenced. However, the previous regime of good governance had alerted the Northern Expressway project and dealt only with the Central Expressway. Accordingly, the plans to extend the expressway to Jaffna was changed and attention was focused only on the construction of the expressway up to Kandy. During the previous regime, there have been unnecessary delays on highway construction. However, with the present government coming into power, measures have been taken to expedite the construction in the third stage. Prime Minister Mahinda Rajapaksa has also said that normally they have undertaken such onerous tasks through following contract basis. However, the government has decided to directly hand over such contractors to Sri Lankans. Therefore, the countrymen are preparing to take serious responsibility of constructing the expressway themselves. This is an extremely important incident. The Prime Minister has recalled how they had created significant change in the country since assuming power in the past few years. They were able to end the decade-long war in the country. Their foundation has been laid for development of the country in all aspects. However, the previous government that came into power for a period of 5 years had destabilized all these development activities. The country had gone backwards by 5 years. The present government was faced with the responsibility of reversing this trend. The Prime Minister pointed out that the support of all people is needed to fulfill the development tasks. He further said that infrastructure facilities should be laid in order to development of the country. The Prime Minister also added there have been an understanding particularly on shortcomings and the lack of facilities in Kurunegala district. The President has instructed to prepare special programs on development and to focus more attention, especially on elephant-human clashes.
Chairman of the Presidential Task Force on Economic Revival and Elimination of Poverty, Basil Rajapaksa says that when implementing budget proposals, more attention will be focused on development of the country as well as on generating more employment opportunities. Well, he further says that the government has also decided to set up new rural granaries throughout the island as it has become necessary to maintain a guaranteed price for rice and to stockpile adequate paddy resources. Chairman of the Presidential Task Force, Basil Rajapaksa, has made these remarks addressing the Sabaragamu Provincial Committee discussion of the national program on Gamasamaga Pilisandara Tulin Vadagamayali Gamata set up with the objective of implementing budget proposals. The meeting was conducted at the auditorium of the Sabaragamu Provincial Council in Ratnapura today. It has been pointed out at the meeting that substantial funds has been allocated through the recent budget for the setting up of new grain storages. These centres are scheduled to purchase at least between 8 to 10% of paddy harvest of every farmer. The chairman has further stressed that the government has handed over necessary fertilizer and other facilities especially to the farmer who engage in paddy production. Mr. Basil Rajapaksa also said that the government's program to provide every person the ownership of deeds of their lands is being implemented expeditiously. The provision of ownership of lands is a pledge given through the Saubhagya Dakma policy statement. The people's representatives at the meeting have also presented facts relating to road development, drinking water and crop damages caused by wild animals in the central province. Minister Vasudevananayakara has made a clarification on the water projects being planned to resolve drinking water problem in the Sabaragamu province. Many road constructions in the province are also to be speedily carried out. Chairman of the Presidential Task Force has further pointed out that power generation from refuse has already commenced as a remedy to the garbage problem. Ministers Vasudevananayakara, Pavitra Vanyarachi, Sabaragamu Province Governor Tikirikobba Kadua, Southern Province Governor Vile Gamage, Deputy Speaker Ranjit Siembalapitia, State Ministers Kanaka Hera, Janaka Vakumbura, Taraka Balasurya, parliamentarians from provincial councillors, heads of local government institutions and other government officials, as well as political delegates representing the Ratnapura and Kegol district have participated in the discussion, and the Western Province meeting is scheduled to be held in the Temple Trees on next Monday.
Meanwhile, only one individual has tested positive for COVID-19 from the rapid antigen test conducted on 750 persons leaving the Western Province today. 5 people tested positive for COVID-19 following some 451 random antigen tests carried out on people leaving the Western Province as of 4 p.m. yesterday. Health authorities have expanded the process of conducting rapid antigen tests during the festive season.
From the Ministry of Health, we have already arranged random checking process for those who are leaving the Western Province in several spots or checkpoints located in different parts of the Western Province. There are numbers of clusters, especially in small numbers, are being reported in different parts of the country. And this is basically due to the increased travelling or movement of people to different parts of the country from the high-risk areas. And that indicates that virus could be present in any part of the country irrespective of the population density or any other factors that we may have considered initially. So therefore, whether you are living in Western Province or in any other part, firstly, as I requested, reduce your or restrict your movements during this season and the new year to the minimum, and adhere to the stipulated health guidelines as frequently as possible to the maximum, so that the possibility of spreading the disease will be minimal and you all will be safe and your loved one will be safe and the country will be safe and we will be able to enjoy a happy new year.
Well, moving on to the corona situation in India now. India exceeded 10 million infections of the coronavirus on Saturday, much later than predicted only a month ago, as the pace of infections slows despite many in the country giving up on masks and social distancing. After hitting a peak of nearly 90,000 daily cases in mid-September, daily infections have averaged around 30,000 this month, while helping India widen its gap with the United States, the world's worst affected country with more than 16 million cases. India reported 25,152 new infections and 347 deaths in the past 24 hours. Data from the Health Ministry showed the virus has so far killed 145,136 people in the country. India took 30 days to add the last million cases, the second lowest since the start of the pandemic. The country expects to roll out vaccines soon and is considering emergency use request for 3 types developed by Oxford, Pfizer and local company Bharat Biotech. Well, with that, now let's take a look at how the world combats COVID-19 pandemic. Moderna Inc.'s coronavirus vaccine on Friday became the second to receive emergency use authorization from the U.S. Food and Drug Administration. Welcome news to a nation with a staggering COVID-19 death toll of over 311,000 lives lost.
Drug Administration gave Moderna the green light on Friday night to provide doses of its coronavirus vaccine to millions of Americans for inoculation. Moderna's vaccine became the second to receive the Emergency Use Authorization, or EUA. Welcome news to a nation with a staggering COVID-19 death toll of over 311,000 lives lost. The FDA announced the authorization one day after the agency's panel of outside experts endorsed its use. The authorization follows an EUA granted for a similar vaccine from Pfizer and German partner BioNTech that has been put into the arms of thousands of U.S. healthcare workers this week in a massive nationwide rollout.
The Ministry of Health says that the number of fully cured COVID-19 patients has reached 27,552. The percentage of fully recovered patients is 75.39. Accordingly, 24.16% of patients are undergoing treatment. 10,562 corona-recovered patients have left hospitals since the beginning of this month until today. The discharging of highest number of patients, 785, was recorded on the 16th of this month. 491 fully recovered patients have left for their homes today. 75 fully cured corona patients have left the COVID-19 center in Polonnaruwa today. 77 fully cured COVID-19 patients were discharged from the Pirinavalla COVID treatment center today. 15,286 PCR tests were conducted yesterday. Accordingly, the total number of PCR tests up to now has reached 10,097,366. 495 more COVID-19 infected persons were detected in the country today. They were all close contacts of the patients of the Paliagoda cluster. 491 fully cured COVID-19 patients were also discharged today. Meanwhile, conducting a random antigen tests of persons leaving the Western province took place today as well. The objective was to identify corona-infected patients. Accordingly, one COVID-19 patient was identified through random antigen testing conducted on 750 persons who were leaving the Western province today. A minor employee at the Kegal General Hospital has been identified as a COVID-19 patient. As a result, PCR tests were conducted on 63 close contacts of this patient, including his wife and other minor staff of the hospital. It has found out that one of the close associates was a corona-infected patient. Ward number 5 of the hospital has been temporarily closed down. The accident victims of the hospital were transferred for preliminary treatment of the Mavanala Base Hospital. The Colombo District Secretariat and the Department of Sports Development have commenced a program to enhance mental health and physical health of residents in multi-storied housing complexes in Colombo which have presently been isolated. Nine police divisions in Colombo and 32 Grama Seva divisions in numerous parts of the island continue to remain under isolation. Minister of Health Pavitra Vanniyarachi says that she values the assistance provided by medical administrators in management in the health sector as well as in the ongoing COVID-19 control program. The minister has made these remarks participating in the 27th annual session of the Medical Administrative Council in Colombo. The attention of the Sri Lanka government and the World Health Organization has been focused on the preparation of a strategic plan to produce the corona vaccine. This was disclosed at a meeting between State Minister, Specialist Physician Dr. Sudarshani Fernandapulle and the Sri Lankan resident representative of the WHO, Dr. Razia Pence. The meeting has also focused attention on future action to control the COVID-19 pandemic. 3 persons have been disappeared when a cab fell into the Vaunikulam reservoir in Mullaitivu. The police say the accident has taken place around 4 o'clock this afternoon. The Vaunikulam reservoir is located in the Malawi Police Division. It has also been reported that the victims were a group of residents of Silapuram in Malawi. The police further say that the 38-year-old driver of the vehicle, a female child of 2 years and a male child of 12 years were missing. A 12-year boy who was traveling in the vehicle has been rescued. Further search operations are underway.
Meanwhile, 187 trained Army cadet officers have dispersed at a parting out ceremony parade at the Talava Army Camp today. The guest of honor on this occasion was Defence Secretary retired Major General Kamal Gunaratne. The group has been recruited for training under 3 categories of courses. Among those in today's passing out parade were 17 female cadet officials as well as 3 amateur cadet officials from Maldives and Zambia. In addition, 16 Sri Lankan cadet officials who have undergone training in the Royal Defence Army in Zambia, China, India and Pakistan also took part in the parade. Chief of Defence Staff and Army Commander Lieutenant General Shavendra Silva also attended the event.
State Minister Siripala Gamlat says that specialists have confirmed that the Victoria Reservoir has not been affected by any means due to the intermittent tremors taking place in the area. The State Minister has made these remarks while engaging in an inspection tour at the Victoria Dam this morning. The Victoria Dam is the highest dam in the country. It was constructed during the first half of the 80s decade through aid of the British government. A 210 megawatt capacity power plant is located along the Victoria Reservoir. The reservoir daily irrigates water to the Maha Valley B and C zones. The reservoir holds a water capacity of 722 cubic millions. The Victoria Dam has been built according to the arcing technology. More than 400 new technological equipment monitors the functioning of the reservoir throughout 24 hours of the day. The work is being carried out by professional engineers and technological staff. There are alternate plans to relocate residents living in the lower valley in the event of any impact on the dam. The international specialists have prepared a special high technological analytical project on the Victoria Dam. Residents in the area have expressed suspicion on any possible damage on the Victoria Dam, constructed according to 35-year-old technology, when tremors were reported from areas including Digana, Alutwatta and Haragamo. The government, taking into consideration of the concerns of the residents, has commenced a program to expedite activity and update the condition on the stability of the main reservoir and the dams. The inspection tour of the State Minister at the dam was part of the process.
That's it for tonight's English News Update. Thank you for joining us. Good night.
Good night.